I'm Courtney Springer. I'm the Assistant Commissioner for Facilities at GSA PBS. Underneath my purview, I've got the Delegations program and water management under OFM as part of many other programs that we manage here at GSA. So I just wanted to start out with a little brief intro and let you know what we're doing and why we're here. So many of you know, since 2016, we've had a water management policy in place at GSA. That policy had come up for renewal this last year, and we had a number of interesting things happen all at once at GSA. Not only did our policy come up for review, but we had an instance of legionella in one of our facilities in Detroit come up in July. And then from July until we were issuing our policy, we had a total of 19 facilities between owned and leased, a mix, that came up with some sort of instance of legionella in the water that we had to manage. We have made our way through a number of those facilities. Many of those facilities required minor modifications to the potable water distribution system, adjustments to the chemical treatment of cooling towers, and or flushing. In the majority of them resolved the issues. We noted this as a potential issue and decided we needed to note it in our water management plans going forward. So as we developed our new program and policy, we implemented legionella as a significant focus area. My colleagues today are going to run you through a number of different reasons of why, what our policy looks like, what we're doing, what our response is today. They're going to run you through all that information. I want to make sure you know as we start this presentation, we're here to help, support, and try to make this implementation as easy as we can for you and for your customers. I want to let you know that as we developed our policy, we didn't do it in a vacuum. GSA reached out to a number of different entities, organizations, state and local government to get support and help in putting our policy and guidance together. So among those, we've been hand in hand with CDC. When you go to CDC's website, you see they have information about Legionella and Legionnaire's disease. They also track the number of cases. That will be something that will be covered a little bit later this morning about the increased number of cases that we've seen. A ninefold increase from 2000 to 2019. We also met with state epidemiologists. We've discussed our plan with them, our approach, and gotten feedback from them. State of California General Services, we also held a discussion with that group. They manage 60 assets that are owned in California, and they went through what their testing program looked like. And how they managed and managed communications as well. So that's the many regulators we've been involved with. On the industry side, we've had strong influence from ASHRAE. As many of you know, ASHRAE updated their standards on water quality management last fall. Those standards were issued in the ASHRAE 514 guidance. The policy that we put together meets or exceeds that guidance, but it was a focus and a guiding factor in the development of our policy. So today you're going to hear about GSA's approach. Our approach is going to be similar to the approach we're requesting of you and the delegated facilities. Our focus is essentially twofold. We're focused on our leased and our own facilities. On our own facilities, we're focused on baseline water testing in all buildings that are over 1,000 square feet with potable water. On buildings that meet the requirement of a focus building, you'll hear that several times through this conversation. A focus building is a building that's over 6 stories tall, over 50,000 square feet with 1 or more potable water booster pumps. In those focus buildings, we're going to have a water management plan in place. Brad, in just a few minutes, will go into the details of what that baseline testing looks like. We'll also go into the details of what the water sampling and flushing plan or water management plan will look like in those focus buildings. In our lease facilities, we're doing the same baseline test that we're doing in our owned inventory as well. a significant undertaking in testing and flushing plans long term based off the implementation of this new policy. So we're here to help support. We've developed scopes. We have multiple recorded sessions of trainings, both to building management and to customers. We have a website that we've developed at GSA. We also have a fact sheet that goes into detail about what we're doing and why we're doing it. What I would like to leave you with today is two things. Please, if you run into a snag, something you've run into that you don't know or would like clarification on, please reach out to us. We're here to help assist. We've managed 19 instances of legionella in our buildings owned and leased. You're probably not going to surprise us with something we haven't been through. We want to help. The second thing I would leave with you is industry does not have a requirement for this level of testing. But we think it's of significant importance, especially because of the downtime that our facility saw over COVID. So I hope when we're relaying this to customers, this isn't something that we just find in federal buildings. I've learned a lot about water management through this and how I manage water in my own personal home. I think this is something that we should take away and understand that GSA and all the entities that are implementing this in our delegated facilities are leaning forward in water management, and we're going to have some of the best facilities from a water management perspective in our inventory. So with that, I'll turn it back over to Tracy to go over some logistics, and then we'll get into the presentation.
Thanks, Courtney. Give me a moment to share my screen. Okay. My name is Tracy Tabbert, and I'm the National Program Manager for Delegations. Before we begin today's session, I wanted to go over a few logistical details with you. Please mute your meeting microphone or phone. We will open it up for questions at the end of the presentation, but feel free to add questions directly into the meeting chat as we cover the material. If we run out of time and cannot respond to all the questions, we will add them to the Q&A document that will be made available to all registered attendees next week, hopefully. A copy of the slides were shared this morning with all registered guests prior to the training. And we will be so you can follow along if you're on the phone. We will share sample templates and resources with all registered guests, hopefully sometime today. I'm hoping to get those out. We have one document that we're still tweaking, so we hope to get that out today. Without further ado, I'm going to pass it over to Brad to get us going.
Thanks, Tracy, and welcome everyone. And maybe just one more logistical detail before we get started. This is the same training we did give the last 2 days, so if you attended one of those previous trainings and you don't want to sit through another version of it, please don't feel like you have to. It will be the same content and the same material, but if you want to join us for another day, you are certainly welcome. So with that, let's kind of jump in. So as my last two colleagues have said, this is the GSA training on the updated order and desk guide for drinking water quality management, along with the revised standard operating procedures for operating and maintenance of delegated real property. My name is Brad Short, and I work in the Office of Facilities Management as the National Industrial Hygiene and Safety Programs Manager. Next slide, please. Today, I'll be joined by my OFM coworker, Raymond Ramirez, who also works in Office of Facilities Management and Facilities Operations. And then finally, Courtney Hatchell, the OFM Chief of Staff, will help close out the presentation for us today. So I'd like to start by discussing why we're focusing so much time and resources on these changes. So established in 2016, the GSA Order on Drinking Water Quality Management played a pivotal role in upholding our drinking water standards within PBS by serving as the basis for ongoing efforts to provide clean and safe drinking water to the occupants that we serve. However, there was a significant trend that demanded our attention. So according to the CDC, reported cases of Legionnaire's disease had surged by nearly 9-fold since the year 2000. GSA also saw a similar uptake in incidents recently. PBS has already taken steps to address 19 of these individually identified Legionella issues nationwide. And then moreover, in light of the Office of Inspector General audits and alert memorandums, PBS recognized the need for substantial updates to the order. The updates reflect the agency's commitment to a more proactive approach to water management, and our objective is clear. We aim to provide clean and safe drinking water to all those who rely on us while keeping up with the latest advancements and insights in the field of water management. So in the next hour, we'll delve into the specifics of these updates and most importantly, how they'll impact building operations. So going back to those facilities that we identified earlier and also that Courtney talked about, specifically, there's been 15 federally owned facilities and 4 leased facilities that have been impacted by Legionella issues. This is a matter of great concern as it directly affects the safety and well-being of those who occupy or visit these facilities. Out of the total number of impacted facilities, 14 have successfully received the all clear status, indicated by the green color. And this signifies we've effectively addressed and resolved the issues in these particular facilities. And Courtney and I have given this presentation quite a few times. And one of the positive things that we see is that these green numbers keep growing by each time we give this presentation. So it's really a commitment to the hard work that people have been doing in the field to effectively address these issues in a timely manner. This next slide shows the references to the various OIG documents that solidify the need for these changes. If you're interested in learning more, you can do a simple Google search of any one of those document control numbers, or you can go to the GSA OIG website for each one of these documents. This next slide shows that significant uptrend in Legionnaire's disease cases reported by the CDC and other epidemiological organizations. And Legionnaire's disease is essentially the medical condition that can develop if you're exposed to Legionella bacteria. And this graph is spanning from primarily the years 2000 to 2018, but then we also see some data after that, at which point there was a significant downtrend during the pandemic when all the facilities shut down, and then the incident rates have started to rise again. We don't have concrete data for the last few years because those kind of trickle in over the year. But it's important to note that the CDC really hasn't pinpointed a definitive reason for this increase. It could be attributed to a variety of different factors, including heightened awareness, more rigorous testing, a potentially more susceptible population, an increase in presence of Legionella in the environment, or really, more realistically, a combination of all of these elements together. But the CDC continues to study these trends to gain a better understanding of the situation. Nevertheless, the message conveyed is pretty clear from here. We're facing a significant rise in the cases of Legionnaire's disease over this period in the United States. Next slide has a variety of applicable standards that were incorporated into the updated order and desk guide, including those from the Code of Federal Regulations, OSHA, EPA, CDC, ASHRAE, and various others. I'm not going to spend time going through each one of them, but they're outlined in the order if you want to learn more. This next slide has some more additional standards that were used in the incorporation as part of the order. You'll notice in the order and desk guide that some of these are linked. However, any of the ones that are paid resources cannot be shared with organizations outside of GSA for copyright issues. When Tracy sends out the reference material, there will be links to the organization's website if you wish to purchase these for your organization as well. Excuse me. So let's start by talking about where our water comes from. So a public water system plays a critical role in delivering safe drinking water to the public. It serves the vital function of supplying water for human consumption through pipes and other conveyances. And to be a public water system, it must have a minimum of 15 service connections or serve an average of 25 people for a minimum of 60 days each year. The EPA has further categorized the public water system into 3 distinct types. So the first one we have is a community water system, which is kind of the most common and what we normally think of for a water system. And this consistently supplies water to the same population year round. The second type is a non-transient, non-community water system, which regularly provides water to people for a minimum of 6 months per year. And lastly, we have the transient non-community water system. And that serves places where people do not stay for extended periods of time. Maybe think of like an RV park for something like this. And a public water system is responsible for continuously providing safe drinking water to the public that meets the EPA National Primary Drinking Water Regulations of the Safe Drinking Water Act. Furthermore, and somewhat confusing here, is that a public water system can be publicly owned or privately owned. In very limited capacities, GSA owns and operates these different types of public water systems listed here. However, the vast majority of our facilities are provided by public entities. Your delegated facilities might also own and operate some of these types of water systems. So it's important to know what applies to your facility. On the other hand, there are also private water systems, such as private wells. These typically serve individual households or small groups of people and are not regulated under the EPA Safe Drinking Water Act. However, it's important to highlight that while the EPA sets federal drinking water regulations, individual states or local authorities can establish their own, more stringent drinking water regulations. And unlike a public water system, private water systems are almost exclusively privately owned. GSA owns and operates several of these systems, mostly in remote land ports of entry, for example. Your delegated facilities could also be owned and operate a private water system. So again, it's important to know what your system is receiving its water from. So no matter if a building gets its water from a public or private water system, the parties responsible for the water system or the controlling authority for that facility must ensure compliance with applicable federal, state, or local drinking water regulations. So now let's move into our facilities, now that we've talked about where our water comes from. So the quality of a facility's drinking water is influenced by a variety of different factors. It's not solely about the water source itself. Rather, it's a complex interplay of elements that shape the quality of the water that we rely on for consumption. One of the key factors is the design and condition of the building's plumbing system, the integrity of the pipes and infrastructure within the facility, which plays a pivotal role in maintaining that water quality. And furthermore, the maintenance and operation practices, construction activities, and even occupant behaviors within a facility can all have a significant impact on water quality. In addition, we must also consider those issues related to that water system. Facilities often find themselves in a position where they have limited control over the water quality issues originating from the water system. Think of maybe like a boil order that you receive notification for. Maybe even during these recent winter storms, you received something like that because the drinking water treatment plant couldn't control their treatment processes. So you get something in the mail or an email that says, hey, your building is under a boil order. That's the type of situation that we're talking about here. So in these situations, an agency's ability to act is contingent upon notification from those appropriate authorities. The primary responsibility for ensuring safe and clean water lies with the public water system, which manages the entire water journey from the source through treatment and then all the way to distribution. However, when a federal facility receives water from a public water system that meets applicable standards, the torch is then passed to PBS, a lessor, or an agency with delegated O&M authority. Their role is to provide potable water at those point of use outlets. I'll now pass it over to Raymond to tackle the next section for the team.
Thank you, Brad. Next slide, please. Okay, this slide takes a step back, so to speak, and lists PBS actions to date so everyone can better understand where we've been in relation to where we want to go. 2016 was the creation and adoption of the PBS Water Quality Management Policy, along with its corresponding Drinking Water Quality Management Desk Guide. 2020, as you may recall, was the start of COVID. As agencies shifted their approach to work, such as increasing telework flexibilities, building and tenant populations, simply weren't at the levels prior to the pandemic. Recognizing that fixtures and other typical building usage features would be significantly impacted due to the reduced tenancy, OFM issued an internal guidance to GSA facility managers to flush buildings based upon occupancy levels. As the pandemic was moving closer to becoming endemic and tenants started returning to the buildings on a more regular basis, OFM issued a reminder internal to GSA in 2021 on the guidance, as well as a suggested plan on how and when to discontinue building flushing that included a gradual reduction in spot checks of chlorine. More recently, a GSA internal facility management alert was issued in August of 2023 based around the notion of water stagnation. The premise of the alert and updated guidance recognized that some facilities may have different post-pandemic occupancy levels and require O&M contractors to thus create a water sampling and flushing plan to ensure fresh water at point of use outlets is being provided. At the same time, GSA partnered with the CDC to gain input and review intended response actions. To ensure a similar approach to our leased facilities, the GSA Office of Leasing issued a letter to all lessors reminding them to stay diligent and in compliance with providing fresh public water and to encourage implementing corrective controls when complaints arose. Next slide. We previously talked a lot about the source of our water, so now let's move into what GSA is doing within our facilities to help improve water quality. We will discuss each one of these topics in much greater detail as the presentation moves forward, but here's a preview. There will be baseline water testing performed in FY24 on nearly all of our delegated buildings. This testing can be done by the existing O&M contractor based upon a sample scope of work developed specifically for this effort and shared with you. Moving to buildings requiring flushing, there are about 23 delegated that will be defined as such. These buildings were selected using the same methodology as ASHRAE 514 uses, or meaning the facility is greater than 50,000 square feet. It has one or more potable water booster pumps, or the building is more than 6 stories tall or more, is more than 6 stories tall, excuse me. A water sampling and flushing plan will need to be developed, and there is also a statement of work to be shared that includes an example for the O&M contractor to cite when developing a plan tailored for that particular building. Lastly, there are 13 delegated facilities that have already gone a step further and have implemented an ASHRAE 188 water management plan or an ASHRAE 514 water management program. In these instances, regions will share the National Risk with the National Risk Management Office any building plans that they've developed. The National Risk Management Office will review these plans for current ASHRAE compliance. Agencies will ensure the plan is incorporated into the existing O&M contract and ensure it addresses the target areas, such as child care centers, health units, and showers. There are a variety of documents that will be associated with each of these actions and shared with registered attendees after the training. Next slide, please. Additionally, there are 23 delegated focus buildings that have certain water features that will require weekly flushing activities in child care centers, health units, and building common and tenant shower areas. In these instances, contract modifications will still be required and sample statements of work for these is also provided. Finally, facilities with cooling towers will require monthly legionella testing when in operation during those buildings' respective cooling seasons. Obviously, this requirement will somewhat differ on frequency based upon your geographic area and how long your cooling towers are in operation. Ultimately, though, if the tower is running in any given month, testing will be required. And like the rest, a sample statement of work for this action is also going to be provided. At this point, I'll turn it back over to Brad for details on all this stuff we just talked about.
Great. Thank you very much, Raymond. All right, now let's dive into the details of each one of those topics that Raymond introduced us to just a minute ago. We'll begin with the largest one, the PBS guidance to restore or maintain water quality, which again applies to buildings over 50,000 square feet with one or more booster pumps or buildings over 6 stories in height. And this comes from ASHRAE 514 that my coworker Courtney talked about at the beginning of the presentation. Please note that buildings that have already implemented an ASHRAE 188 or 514 water management program for the potable water system are exempt from this guidance, as those are kind of the gold standards in the industry. An integral part of the guidance is for the O&M team to develop a water sampling and flushing plan that outlines all the building-specific details. Some key elements of the plan are confirmation that a workplace hazard assessment has been performed, information about the water system, including the disinfectant that's used and the target concentration range for the building, the maximum temperature allowed by regulation and code in your local area. These are typically between 120 and 124 degrees Fahrenheit. The number of outlets in weekly flushing for focus areas, and a determination of the number of zones for the building based on two criteria: the number of main water lines and the number of hot water systems. So let's take a look at logistically how that's broken down. So as outlined in the chart, if a facility has one main water line and one hot water system, the building would have two zones. If the building has one main water line and two hot water systems, it would have three zones. Similarly, if a building has two main water lines and two hot water zones, the building would, two hot water systems, the building will have four zones. And this pattern continues similarly. Like Raymond was saying, certain areas of focus will require weekly flushing, with aerators requiring monthly cleaning or replacement if damaged. These areas are chosen based on the population they serve and their operational characteristics. They encompass health units, child care centers, and showers. Furthermore, where feasible and, if applicable, dead-end legs identified during routine maintenance should be flushed monthly. The plan also has building equipment requirements. Hot water recirculation pump should be run continuously. The circulating hot water should be maintained within the range that's identified in the plan. Sorry about that. That's typically that's typically between 100 and 124 degrees Fahrenheit. And then hot water tanks should be set at a minimum of 140 degrees before any down mixing occurs. Point of use water heaters should be maintained within the range that's identified in that plan. Again, between 120 and 124 degrees Fahrenheit. So let's look at that sampling and flushing. It would start at the main water line and systematically progress outward through the potable water system, concluding at those furthest outlets. This is what's referred to as unidirectional flushing. At each water sampling event, at a minimum, should encompass the following: the water outlet nearest the main water line, an initial outlet within each designated zone, an outlet situated approximately in the middle of the run for each zone, and a furthest outlet within each zone. Additionally, a random selection of additional outlets representing about 10% of the total, with a focus on areas that are presumed to be infrequently used, such as maybe a visiting judge's chamber, jury assembly rooms, or unoccupied areas. And if you don't have any of those, no big deal, just a random selection of 10% either way. Now that we've looked at the locations that will be checked, let's talk about how this will be completed on a monthly basis for cold water outlets. Prior to any flushing, the O&M contractor will measure disinfectant residual to determine if flushing is even required. So the measurement of disinfectant residual varies depending on the water supply. For buildings supplied with chlorine, it's necessary to measure free chlorine, while buildings supplied with chloramines, total chlorine should be measured. Field test methods approved by the EPA should be employed. If an outlet registers an undetectable disinfectant residual, flushing is required until a detectable level is achieved. If there's a consistent reduction in disinfectant residual at those point of use outlets, the O&M should seek guidance from your agency's subject matter expert responsible for drinking water. Furthermore, if any outlets where no disinfectant residual can be detected, even after multiple rounds of flushing, the O&M should seek guidance from your agency's subject matter experts responsible for drinking water. Here's a visual representation of what we just talked about. And this flowchart is outlined in the guidance that Tracy will provide to your organization, so I'm not going to spend too much time going through it right now. Let's switch over to the hot water and look at what the monthly sampling and flushing plan looks like for this. So hot water is flushed at those same outlets as the cold water within each zone until it reaches its maximum temperature. The maximum hot water temperature is then measured using an instantaneous digital device, and that delivery temperature is adjusted to be maintained within the hot water limit that we identified in the plan. If you remember, this is typically between 120 and 124 degrees Fahrenheit. It's important to note that outlets equipped with automatic mixing valves will not provide an accurate reading of hot water temperature, as the water is pre-mixed with cold water. If a zone is unable to meet the temperature requirements even after multiple adjustment, it becomes the responsibility of the O&M team to contact the agency's SME responsible for drinking water. Similar to cold water, here is a visual representation or a flow chart for the process that we just discussed for hot water. Again, included in the guidance, so don't feel like you need to go through it all at this moment. To streamline and standardize the creation of the water sampling and flushing plans by the O&M contractors, OFM created a sample water sampling and flushing plan template, along with a completed example for a fictional building based on that template. This resource is designed to assist in the development of these plans and allow for consistency across the regions. The finalized plan is to be submitted to GSA email account using a specific naming convention. And if a building already has, or you guys choose to develop an ASHRAE 188 or a 514 water management program instead of using this template, that's completely fine. Please just submit it to the GSA email account as well, so we could have this in our records that it has been completed. And then all recurring information should be recorded in your agency's computerized maintenance management system, or CMMS for short. Okay, let's move on from this guidance. I feel like we've talked enough about this one. And let's expand to talk about our larger inventory and some additional steps that our agency is taking. One of the main ways that we stay informed about the water quality from the public water system is what's called a Consumer Confidence Report, or a CCR for short. And the EPA requires that community water systems make that CCR publicly available or send it to their customers each year by July 1st. The O&M contractors for all federally owned facilities served by a community water system must review these reports annually, and if any issues are noted, provide notification to the agency's SME and document it in the agency's CMMS. Another major component of the GSA National Water Management Strategy is to conduct baseline testing in FY24 in both owned and leased facilities. This will include approximately 1,400 owned facilities and 6,000 leased spaces. An initial drinking water test will be performed in all currently active and occupied federally owned facilities exceeding 1,000 square feet that have drinking water systems. And this entails testing a minimum of 10% of water outlets designed primarily for human consumption, which would include our drinking fountains, our bottle fillers, our kitchenette faucets, things like that, for the presence of legionella, lead, copper, and total coliform, including E. coli. Additionally, a representative number of water outlets must be subjected to legionella testing, and this would encompass various points within that hot water system or cold water system, such as the incoming service line, the water storage tanks, expansion tanks, hot water recirc circuits, and common and private tenant showers. The test results surpassing federal, state, or local thresholds will necessitate remedial action. So during routine or reactive testing, PBS follows the most stringent state or local thresholds, and in the absence of such standards, the EPA National Primary Drinking Water Regulations are used. Specifically for lead, the threshold is 15 parts per billion, while for copper, it's 1,300 parts per billion. Total coliform and E. coli are reported as either present or absent, with the presence indicating a potential issue. For legionella, it's not as cut and dry, unfortunately, but PBS adheres to the CDC guidance for routine testing of legionella. This guidance considers several factors, including concentration measured in something called colony-forming units per milliliter. For potable water used for drinking, well-controlled conditions show detectable levels up to 0.9, while poorly controlled conditions range from 1 to 9.9, and uncontrolled conditions exceed 10. Non-potable water used in mechanical systems follows a similar pattern. Well-controlled conditions show detectable levels up to 9, poorly controlled from 10 to 99, and uncontrolled exceeding 100. To add a little complexity, the extent of colonization, the type of Legionella bacteria, and changes in concentration are also taken into consideration when determining if the system falls into well-controlled, poorly controlled, or uncontrolled. Systems in well-controlled conditions require no further action, but poorly controlled or uncontrolled systems necessitate additional responses. And similar to the plans, the final drinking water testing report will be attached to the agency's CMMS and also sent to the GSA email address using a specific naming convention. Moving on to one more different topic before passing it back to Raymond, let's talk about the facilities that do not qualify for the implementation of the PBS guidance to maintain and restore water quality. So if you have facilities that are smaller than the requirements established in that guidance, there are still certain areas of the facility that will demand regular attention. And these areas would require weekly flushing, with aerators requiring monthly cleaning or replacement if damaged. And the selection of these areas is determined by the population they serve or their operational characteristics, encompassing health units, childcare centers, and showers. The notable difference here is that there's no mandatory plan that's required, and other building areas outside of these spaces do not require additional sampling or flushing. At this time, I'll pass the floor back to Raymond to delve into some of the non-potable elements, which, while not explicitly covered in the GSA order on drinking water, are an integral component of our overarching water management strategy.
Thank you, Brad. This next slide is really to reiterate the expected requirement for non-potable water systems, essentially those building systems that are left open to the elements. And again, this was, as was mentioned before, but any facility with a cooling tower will be required to be tested on a monthly basis when it's in operation. The test will be Legionella specific and not simply based on a total bacteria count. Similarly, monthly Legionella testing will also be required for ornamental fountains or water features that release aerosols in the buildings or on site during their operating season. Additional water feature examples can be misters or humidifiers if they exist at your facilities. Humidifiers or misters that use steam need not be tested. Next slide, please. You may be wondering how much implementing these requirements is expected to cost. So this slide shows a high-level estimate of close to $47 million split between federally owned and delegated facilities and leased facilities. This estimated budget is an aggregation of testing and flushing throughout our portfolio. We talked about the requirements for non-potable systems and a little bit on the money to be spent. And now I'll turn it back over to Brad, who just had 10 seconds to catch his breath, who will get into a few more specifics on building schedules and details. Take it away, Brad.
Thanks, Raymond. I appreciate the break. Gave me an opportunity to grab a drink. So yeah, I'm gonna jump back in here for childcare centers. So there are a few specific requirements, and the first one we've already talked about before, but based on the unique population that these centers serve, there are some additional things that we take into consideration for these types of centers. So weekly flushing and monthly aerator maintenance are going to be standard practice. Again, we talked about that in a few slides previously. But then in all open childcare centers, annual testing for lead and copper must be conducted on all outlets used for drinking and washing. And this is established a lot of times in their licensing agreement as well. And most states have also moved to yearly testing. So it's something that we used to have an every 3-year process, and now we move to an annual requirement. In any closed childcare center that has been closed for 30 consecutive calendar days or more should be sampled for lead and copper before reopening, and then also include Legionella checks for outlets primarily designed for human consumption. For all newly installed outlets, testing for lead, copper, and total coliform must be performed before use. So moving to our larger inventory, post-installation water testing is also a mandatory procedure when specific aspects of the water system are impacted by repair or renovation projects. Again, as we talked about in the beginning of the presentation, construction activities can be one of the biggest things that impact water quality. And in the previous policy, this was referred to as water commissioning, and it referred people to the P100. However, the P100 didn't have a lot of information on specifics of what to do. So a team of IHs tried to have some logistical items that we could put in here that align with some industry standards. So for newly installed outlets designed for drinking, must be tested for lead, copper, and total coliform before use. In the case of a building replacing building service lines or primary pipes, compliance with applicable plumbing code disinfection requirements is critical, along with adequate downstream flushing of the work. Furthermore, a representative sampling of outlets connected to the new system must be tested for lead, copper, and total coliform before use. When addressing lead service line replacement, water systems must adhere to the EPA's lead and copper rule. And this involves notifying customers and providing appropriate response measures such as pitchers or point of use filters. And this option is also followed up by them extending offers to do testing within our facilities free of charge. They don't have to actually do the testing, but they have to offer the testing to their clients. And the expectation would be that we would take them up on this opportunity and to get the free testing to ensure that the work that that public water system is doing is not impacting our facility. This is actually pretty common in a lot of big cities these days, especially with what's happened in the last 10 or 15 years with several cities in the United States having big increases in lead concentrations coming to the community. So a lot of facilities are looking at their entire inventory of lead service lines and prioritizing the removal and replacement of these. So you might see more and more popping up, especially if you're in, a lot of these bigger cities. So our federally owned facilities are required to follow the water system's instruction and utilize any offered testing as needed. And then finally, in response to incidents, complaints, or emergencies related to drinking water, the delegated agency must promptly investigate these concerns for those facilities that you're managing. And that investigation process entails efforts to identify the nature and source of the suspected drinking water issue, potentially involving follow-up testing. And if the investigation identifies the presence of a drinking water issue, corrective actions are promptly initiated to address and remediate the source of the problem. And then when you do have a problem, obviously follow-up testing is then conducted to verify the effectiveness of these control measures. To determine whether additional testing is beyond that initial area of concern, the agency's SME responsible for drinking water would exercise their professional judgment in this area. And then any drinking water incidents, complaints, or emergencies reported through the O&M contractor or the facility manager are to be documented and stored in the CMMS for record-keeping purposes. Now I'll pass it back to Courtney to wrap us up for the afternoon.
Great. Thanks, Brad. As was mentioned 30 or so slides ago, my name is Courtney Hatchell. I'm the Chief of Staff for the Office of Facility Management. I'm going to start by going through this timeline you see on your screen. This demonstrates the steps that GSA has taken thus far to address drinking water quality in our GSA-controlled delegated facilities. So as you can see from the timeline, GSA began reviewing and updating the SOP for O&M delegations shortly after we revised our GSA order on drinking water quality management in roughly November of 2023. On December 4th, we issued a letter is a very high-level communication. It went to senior real property officers of agencies that have O&M delegated authority in GSA-controlled facilities. And in that message, GSA shared that PBS has issued the updated order in response to the elevated levels of legionella bacteria that we have been detecting in some water of our federally owned and leased facilities, as well as the associated OIG audit and alert memorandums. GSA also shared that we were in the process of updating the SOP to reflect these changes to water quality management that were found in the GSA order. Then on December 26th, we issued that the SOP as well as the updated SOP as well as the order and put forth the training dates for the training that you're sitting in now. Next slide, please. On this slide, and as we had mentioned before, the December letter that was issued to senior real property officers also noted this, but that the new water quality provisions we are putting forth here are expected to be implemented promptly and must be completed within fiscal year 2024. Next slide. This slide contains resources, and it's a list of documents and resources that we're going to share with all registered attendees after the session has concluded. Basically, all of the different things that we've been referencing throughout the material today. Next slide. Next slide, please. Oh, This slide contains hyperlinks to GSA's water quality website and fact sheet, as well as resources that are available for you to purchase. Next slide. Okay, so I'll wrap it up by just first off thanking you all so much for your attendance in today's training. I want to really reiterate Courtney's opening remarks that these efforts are extremely important as they are going to help us ensure that we're providing safe drinking water in our facilities and protecting our customers. So again, thank you so much. We now have some time to open up the floor for questions. So we'll take a little bit of time here. Any questions that we can't get to today, or questions that are specific to how you are carrying out these actions in your specific facility, we'd ask that you direct them to your local GSA point of contact or the building manager that you would typically work with. So that's that. We can go ahead and take some questions now. I think I heard one pop up.
So from Anna, so was any testing done to determine if the Legionella was from the PWS essentially? Yeah, so we do incoming service line testing to see if it's coming from the source. Obviously, all Legionella is really originating from the source as it's a naturally growing bacteria. It's found in very low levels in probably 50% of our facilities. And that's not necessarily the issue. It would be more, do our building conditions proliferate the growth of the bacteria? So do we have improperly stored water at not correct temperatures? Are we not moving enough water to have those disinfectant residuals at point of use? So it's really determining if our building conditions are contributing to the growth of Legionella and causing that small amount that comes into our facilities no matter what to grow.
Thanks, Brett. Any other questions? I do want to note that based on these 3 sessions, we are compiling a list of FAQs that we will be sharing to assist you as you carry out these actions as well.
In addition, I was just going to say, in addition to entering questions into the chat, you can also come off mute. We welcome any questions over the microphone.
Hey, Tracy, this is Aaron Matthews. Can you guys hear me?
We can.
Yep.
Okay, so I keep getting booted from the chat, but I was able to dial in. I just have one question. I'm with the Corps of Engineers, and I'm tracking that this requirement is applicable to agencies with delegated authority for O&M. So, yeah, tracking that for MVD headquarters. But my question is, does it also extend to the Corps' delegated Title 40 GSA leasing authority, like for our recruiting leases and so on? Over.
So these are locations where you have the authority to enter into a lease with a private entity?
Yeah, correct. Under a GSA delegation, right?
Correct. At this point, this does not apply to those locations. That's up to your agency to decide how they would want to, if they would want to implement.
Right, but it definitely applies to a federally owned GSA building where we have delegated O&M authority, correct?
Correct. Exactly. Okay. That's correct.
Gotcha. Thank you, Tracy.
And I just wanted to clarify too. So it also applies to leases that GSA has procured. So in the case where your agency has procured the lease, please correct me if I'm wrong, Courtney, but I just want to clarify that because our leasing office did issue letters to lessors.
Correct. So good clarification, Tracy, because that might have been confusing. So where GSA has entered into the contract with the public entity, we will be conducting the one-time testing at all of those facilities. I think we touched on that in an earlier slide. It's roughly 6,000 or so leases.
But only the baseline testing. Anything that
Correct.
is additional in the order would not be a requirement of that lessor unless it's in their contract.
Great. I appreciate the clarification. I'm just going to relay that information back to my headquarters point of contact. That this right now, I'm sure it will eventually, does not apply to leases the Corps entered into under a GSA delegated authority. Over. Thank you.
Yeah, thanks for your question. That was a good one. Anybody else have items to bring up this morning?
Hi, this is Paul Chair. Can you guys hear me?
Yep, sounds good.
I don't see anything on individual water fountains on this list. Is there anything for just individual water fountains throughout the entire building?
So they are included in the baseline testing, and obviously if there was any issues, there would be corrective action at those locations. They would also probably be included in the 10% of outlets that are getting the monthly chlorine checks. So a good way to ensure that enough water is moving through those water fountains through normal usage would be to check those chlorine levels in there.
Okay, and then should we be adding those to the, like we use GDI, should we add them to our management system into GDI as we go through this process? As I talk to my O&M contractor, I just want to make sure I give them as much information as possible. So
if you think that would be helpful for your organization to kind of track those levels over time, we're doing something similar with our points that don't change. So we have the closest one, the middle one, and the farthest outlet on each zone. So we're making those points that we can track over time in our CMMS system. So kind of whatever you guys feel is the most appropriate and gives you the information that you need.
okay, great, thank you.
Yep. James, it looks like you have a hand up.
Yes, Jim Fay, Department of the Interior. So with the residual chlorine requirement, how would that be impacted if you have a centrally filtered water fountain system that typically would have a lower rate of residual chlorine? Typically that's going to be UV sanitized, but it would not have the same range of residual chlorine as public drinking water.
Yeah, so you have a point of use water fountain on there?
We have a central filter, and then that distributes through piping to point of use fountains.
So in your incoming service line, you have some sort of sediment filter that removes stuff so it doesn't impact your mechanical equipment?
Yes.
Okay, sediment filters don't normally take out chlorine, but you know, they potentially could. And if you're removing all of your chlorine, you're kind of taking out the protection that is provided to the rest of the drinking water system. So it's a situation you got to be a little bit careful of because you're removing the protection that drinking water plant has put into place. So the bacteria shouldn't grow. With that being said, you know, it might be a scenario where a ASHRAE 188 plan is a good alternative in that scenario where there is something that could be contributing to it. That baseline testing will really give you a good idea if there's something going on there. But if the facility is falling under the PBS guidance to restore and maintain water quality, and you guys don't have any chlorine at point of use, and you're able to figure out why, it's something that you would need to tailor a little bit to that. And I would recommend working with your agency's subject matter experts in drinking water and coming up with a building specific solution for that one. But because it is so kind of nuanced and you're filtering out the water for the whole facility and potentially removing all that chlorine, it might be a good candidate for a 188 plan.
And we're working with FOH on that, but I'm thinking specifically with a lot of newer drinking fountain systems, you're going to have filtration, which is going to reduce your chlorine, coupled with UV sanitization. So it's going to be a little bit of a quirk for some of those systems.
Yeah, absolutely. And point of use isn't necessarily as a big a concern because you're only talking about maybe an inch or two of pipe after that, which, don't get me wrong, can be an issue. But when you're filtering out way upstream and you have linear feet in the tens to hundreds of feet with, you know, scaling and build up in those pipes, that's where it gets me, you know, more nervous in those scenarios too.
Thank you.
Mhm.
And just one other point to clarify, as I was pointing you back to the GSA building managers that you interact with at your local facilities, they have also been through extensive training on this, are working through putting these, getting this testing ordered and putting these plans in place at their facilities. So they will be great resources for you as you continue to dig into the guidance. Any other questions for us today? We have 4 minutes left. You can ask who we think is going to win the Super Bowl.
I mean, I'm in KC, so I think I know.
Brad's biased.
Looking for a little Tay-Tay sighting, but
I'll tell you what, I have a daughter who's 7, and we are big Chiefs fans in this house for that reason, and not because she likes Chiefs, because she likes Taylor Swift.
Yeah. No judgment from me.
All right. Well, you guys have been wonderful. I won't keep you longer. We'll give you 3 minutes back, but thank you again so much for your participation and your commitment to helping us ensure water quality in our facilities. So have a great rest of your week. Take care.
Thank you, everybody. Bye-bye.
Bye.